Hello and welcome to Healthy Living. I'm Dr. Donald Pelto, and today I have Mr. Chris Trygstad. He is from Biomedix. Thanks for joining today, Chris.
You're welcome. Thank you, Dr. Pelto.
So you are involved, and you're in Minnesota, as I was talking before. That's where I'm from, originally from Minnesota. And Minnesota has a lot of great companies that have started there and exist in Minnesota. And one of them is PadNet or Biomedix. And so tell me a little bit about the company. How long have you been with the company? How it's doing and things like that?
Yeah, so I've been with Biomedix for 4 years, headquartered in Minnesota, but we have representatives around the country, and we develop and market a vascular assessment system called PadNet, and we also support that system.
Awesome. And in terms of PadNet, who are the typical doctors that use your system? What percentage are podiatrists, and are there other specialties that use it?
Yeah, that's a great question. So I would argue that anyone that is seeing diabetics on a regular basis could really benefit from this system. When we look at the medical specialties who've invested in a PadNet system, it really runs the gamut of the healthcare system. We have a number of systems in radiology and cardiology departments in hospitals. We also have a fair amount of internal medicine, family medicine doctors, as well as wound care centers for limb salvage purposes. Some cardiology offices, standalone cardiology offices also have this system. But we found a lot of success by collaborating with the podiatry community. When we look at our PadNet systems, I would estimate that approximately 50% of our PadNet systems are located in podiatry offices.
Wow.
Yep.
And for those that are watching, let's say they don't have the PadNet system. What are some of the benefits? I know we were talking before a little bit about in terms of for surgical procedures, and what are some of the benefits to the podiatrist to make them a better doctor?
Yeah, there's a couple benefits. So I'd argue that PadNet is a clinically valuable system to have in your practice. You are able to collect ABIs and pulse volume recording measurements from your patients. So it's a more objective test rather than a subjective test like a measurement of peel pulses.
Mm-hmm.
In addition, PadNet is a reimbursable study. We have a long track record of podiatry being able to bill CPT codes 93922, 93923, and 93924, and be reimbursed from plans including Medicare and private pay.
Yeah, that's what we found. And does the podiatrist, are they the ones that read the exam? That might be a concern to some of the podiatrists.
Yeah, no, that's a great question. What makes PadNet unique is that when you perform a test, and typically we find that although a podiatrist can perform a test, but we have a lot of success showing a medical assistant to perform the test. So therefore, you can stand up a service line in your practice without taking up more of your time. So a medical assistant, if they know how to get a blood pressure, they most likely will be able to perform a PadNet test. That PadNet test, without that podiatrist intervention, can be sent to a nearby vascular specialist. Now, anyone can read a test. It is very easy to read an ABI number and a PVR number, but the benefit of taking these vascular measurements and then having a vascular specialist interpret those results allows you to coordinate and collaborate with specialists to deliver better patient outcomes by working with that nearby interventional radiologist or cardiologist. And it also reduces the potential liability you may have as well. So you're simply performing the test, and then you are following up on the treatment recommendations based on what that vascular specialist is providing in terms of interpretation.
Yeah, and a lot of times I find that it'll either say, repeat it in a year. They'll say, maybe they should be seen by a vascular specialist, in which case you just send it over. Or other times it might be more normal. If something's just normal, how often should these vascular studies be repeated by patients? Is it yearly? Is it every couple of years?
That's a good question. So if you're testing someone in an at-risk population, meaning someone with a history of tobacco use over the age of 50, a diabetic over the age of 50, or really any adult over the age of 70, there's a 1 in 3 chance that that patient has PAD. So we find that if you are screening at-risk populations, a lot of folks are testing on an annual basis.
Mm-hmm.
But if the state of that patient's health has changed For example, if they're presenting with the classic symptom of intermittent claudication or pain while walking, and now they're complaining of it hurting while they're even at rest, I would argue that provides medical necessity to perform another PadNet test to ensure that you're properly monitoring that patient.
Yeah, or also if there's a new ulcer, if they haven't had an ulcer before, first time with an ulcer and things like that too, right?
Yep, that's a great point. Yeah, any kind of state of health that has changed within
Mhm.
that patient, really, you should be reassessing that vascular circulation.
And before doctors have had the PadNet, what are most of them doing? Are they sending them to a vascular specialist, sending them for ABIs at the hospital? And how does this make it a little bit easier or better?
Yeah, it's a great question. So we know that there's a fair amount of podiatrists that are maybe doing subjective tests such as pedal
Mhm.
pulses or monitoring symptoms and things like that. What we really think is valuable is the early screening for PAD as soon as those typical symptoms are presenting with the patient, and sometimes even considering prospectively screening at-risk populations. Benefit there is when we've seen that when podiatrists just refer all potential vascular patients to that vascular specialist, they tend to wait too long. So if you are waiting until a diabetic foot ulcer has cellulitis versus when they are maybe having some pain while they're walking, that patient with cellulitis may require revascularization versus maybe recommending a diet change,
Mhm.
supervised exercise therapy program. So, that surgery is more expensive for the healthcare system. It is more dangerous, and then there's less optimized patient outcomes, I would argue. If you can prescribe lifestyle modifications early in the progression of this disease, you're going to save limbs, and then you're going to reduce healthcare costs for that patient and for the healthcare system in general.
Now, you probably know this better than I do in terms of because I don't, with the vascular surgeons, a lot of times they do recommend lifestyle modifications. Is there research? How successful is that at improving PAD?
Yeah, that's a great question. Supervised exercise therapy is actually a relatively new CPT code that was established at the beginning of 2019. There was a researcher named Dr. Alan Hirsch at the University of Minnesota who is a big proponent of supervised exercise therapy. And there's a pretty well-established body of research that shows the effectiveness of that type of program. In addition, there's a lot of research that shows even by detecting, like let's say you have a diabetic patient sitting in your chair and you find that they are now presenting with a complication like PAD, by communicating that to the patient, you're providing that patient with more motivation to engage in these healthy behaviors, because now you're telling that patient now you not only have diabetes, but you're also putting your legs at risk because of these poor lifestyle choices. So research has indicated that patients are more likely to make those smart choices if they understand the impact that it's had on their health.
I think lifestyle changes in general, whether it be diet changes, exercise changes, they can be quite challenging for people to do alone because it's habit change. Do you have any particular people that are any good ideas for that? Can I just tell them, okay, you should walk a block a day or 2 blocks a day, that medically supervised? Is it through a gym? Is it through an actual physical therapist? How does that work?
That's a great question. And yeah, there's a couple different ways we can do it. I know that some heart and vascular surgery centers, some hospitals around the Twin Cities actually have a formalized supervised exercise therapy program. So they actually have patients with PAD come in and engage in that supervised exercise therapy program. You can also encourage a patient to do it on their own, but studies have indicated that by doing a more formalized supervised exercise therapy program, it results in better outcomes.
Well, even if you think of us, if you go to the gym, it's one thing. If you're at a group fitness class, it's something else because you're kind of obliged for, a number of reasons. Either you're paying for it or others are there watching you. There's a lot of more
Exactly.
motivation.
Yep.
That's
Or
awesome. I didn't know
uh,
that existed.
yep. Yeah. Yeah. It's a new CPT code. It's much cheaper than implanting a balloon or a stent further down the road. So
Totally makes sense. That's great.
Yeah.
And that was kind of getting on with the next question here was, how do people prevent from getting PAD or treat PAD? And I think those are some options that would be the medically supervised exercise. So I'll put some links on this video to maybe some recommendations or some articles you could send me. I'll put them on the bottom of this video. Great.
Okay, sounds good.
And then I wanted to ask, how is, in terms of COVID, I know everyone's talking about COVID, and what are some of the effects, vascular, biomedics, and things like that in terms of people's health?
Well, I think COVID has really kind of underscored the impact that health can have on your immune system. We found there's quite a wide range body of research indicating that patients that are healthier are have better outcomes if they do get infected with COVID. So
Mm-hmm.
some of these chronic conditions such as diabetes, peripheral neuropathy, peripheral artery disease, COPD, those things compromise the immune system. So if you do end up getting COVID, you're more likely to end up in an intensive care unit and have to undergo some more intense interventions to
Mm-hmm.
address COVID-19. So I think podiatry could really benefit from, financially. I understand that a lot of podiatrists, they're not seeing as many patients. This is a way to screen for more conditions, resulting in a fair financial return, but also optimizing patient outcomes, especially detecting a condition like PAD. You could be recommending that they more aggressively social distance or isolate if they do have a complication like that could potentially affect their immune system.
That's awesome. That's really, really good way to make it more applicable. Now, being in the business, what are the main reasons? Let's talk specifically for those podiatrists that are watching this. What are the main reasons not to do this? Why aren't more people doing this in their office? What do you think after talking to a lot of podiatrists? Some say yes, they try it. Some say no. What are the reasons why they don't?
A lot of we get podiatrists saying, well, I just refer all of my patients to doctors, right? We've heard that again and again. And I think, you end up referring patients that are really far down the road of PAD. And other considerations are they are worried they're not going to see enough patients. PadNet does require an investment. And we provide training solutions and a warranty and things like that to make sure that results in good outcomes. But by doing just one test a week, you can break even with a PadNet system. And we
Mhm.
also provide a service called Chart Review that you can undergo that involves someone from our customer service department remoting into a electronic medical record system. And what we can do is by ICD-10 codes, find patients that you're already seeing that qualify for PAD testing, as well as helping find patients that have risk factors. So you end up with two lists, people that you could test today because they already are in your chart as having, a typical primary indication for PAD, as well as risk factors. And then you could stratify those patients. For example, if you find a patient that has a risk factor for PAD, we offer questionnaires that you could provide at your patient intake process to encourage them to talk about symptoms that they may not be self-reporting to you, but may be more comfortable sharing over a questionnaire.
Yeah, Chris, I think that's something typical because we have so many things to talk to our patients about. And a lot of times, as I think we were talking before, you mentioned, well, how does it hurt when you walk? Well, no, it doesn't. But it also means that they're not walking anymore because their muscles, they think it's just their muscles or their joints that are starting to hurt.
Yeah, exactly. I mean, the conventional wisdom is over 50% of patients with PAD are presenting with atypical symptoms. And, since it is a progressive disease, that ache and pain that may be minor actually gets worse. And, the way that your body copes with that pain may make you tend to underreport that and just kind of chalk some of that leg pain up to an old football injury or just getting old.
Yeah.
And then there's also, I think I'd probably be guilty of this, is underreporting my symptoms. Kind of that fear of, well, something's wrong. I don't want to tell my doctor about it because it's, the devil I don't know.
And I think, Chris, it's similar to what you said before. Oh, I just send everyone else out to the vascular. Well, really, the only ones, when we're in a busy practice, you're only sending the claudication symptom patients or the ulcer patients to the vascular. There's a lot of other ones we're not sending. And frankly, if we did, they would be so inundated. I've asked my vascular people, well, who should I send? They only want to see the ulcers and those that have claudication. They don't want to see every single one that could be symptomatic or non-palpable pulse type of thing.
That is true. And I can tell you, the vascular specialists that we work with around the country find PadNet to be very valuable. They find it as a good way to coordinate with these, really the podiatrists that are at the front line of care. Podiatrists tend to see those diabetic patients a lot of the times, sometimes just to clip nails. But they really are at the front lines of care, ensuring that diabetics get the proper amount and type of care that they need to maintain their condition.
Yeah, I'll put a little link underneath the video here. I'll put that little, it's a PDF flyer that you guys have that doctors can look at if they want to see that. Also, I'm going to put a couple of slides that I have. I found it really easy because based on, you guys really helped me with some of your assistance there. I wasn't doing that much of it. And I was only doing it on people that had, let's say, non-palpable pulses or claudication, which wasn't that many. And I was getting frustrated. And basically, when you guys sent me a ton of articles, and anyone that's interested, you have tons of referred articles they could read. And as I was reading through it, came kind of simplified. I think simplifying is good. And you said something before, basically diabetic above the age of 50 and non-diabetic above the age of 70. I just kind of keep that in the back of my mind. In all the articles that I read, they said, even though they have palpable pulses, even though they look like they're doing okay, those are the high risk people. Is that right, Chris?
That's right. That's right. And I'd like to stress that, I think PadNet has had a reputation of being a test that takes a half hour to take. I think what happens in a lot of cases is people need to understand is PadNet is a flexible system. So you could perform a test, you could perform pulse volume recordings on a patient's legs. And just from that, you can derive a lot of information just from pulse volume recordings. You could increase the I guess how much data you're collecting in that test.
Mm-hmm.
Really, it's kind of up to your clinical guidelines and your professional opinion as a healthcare provider. So that test could take a minute, or that test could take a half hour. It really depends on how much data you want to collect. It's flexible. And there's a lot of different things you can do with the device based on what you're trying to accomplish professionally for your patients, and then from a reimbursement perspective as well.
Great. Well, we covered a lot here, Chris. If people are interested in learning more about Biomedix and maybe considering talking to someone there, how do they get more information?
I'd encourage them to visit biomedix.com. We have customer service reps that are available during standard business hours, and that phone number 888-889-8997 is available. So if you would like to get in touch with someone and talk a little bit more about PadNet and how this could be set up as a new service line in your practice, we'd be more than happy to help. We have a couple different reps, and the customer service rep can ask you a few questions and then direct you to the appropriate representative to talk about how it can impact your practice.
Great. Hey, Chris, thank you so much for your time.
Yeah, thank you. Appreciate it, Dr. Pelto.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.